for my first birth, I was induced. I hit 42 weeks. My midwife told me that I basically had no choice because I was given the choice of finding a new provider or getting induced. And at 42 weeks, it's this person I've been seeing my whole pregnancy. How am I going to say no? Like, how am I going to say, yeah, I'll just find another provider who will just take me on when I could go into labor in any second?
Yeah.
And not only was I basically given no choice, I also was not told about bishop scores and what my bishop score was. I had a bishop score of 0 to 1 at 42 weeks. And through later research, that gave me a chance of having a C-section of over 50%.
Yeah.
And had I been told that, I would not have gone through with the induction. And surprise, surprise, I had a C-section.
Yeah.
And it was basically the worst time of my life. So I just was not given information. I was not given a choice. I was told this is what we're doing. And as a first-time mom who still was reasonably educated on birth, more than I would say most first-time moms.
Mm-hmm.
And it's still like, it's just, that's what giving birth in our community is like.
Well, we were educated on birth, but we weren't educated on the system.
Yeah.
We kind of needed to be educated on the system,
because
we
works,
put our
how
trust in the system.
How you get paid, how
things work out
what
here.
the actual rules are with
Yeah.
midwives. Like, because I was told that she was like, I can't see you after 42 weeks. Like, legally, I can't, which isn't true. She could, she just didn't want to.
Yeah.
She probably had OBs breathing down her neck.
Yeah,
which is,
it was an OB and midwife practice. That was another thing we didn't realize, is that not all midwife practices are able to practice the same way. We went with a completely different practice.
We have a lot of great midwives.
They are
now.
amazing.
We really do.
And I mean, we can't say anything bad about our midwives. We love our midwives. It's the system, basically. That there's good doctors, there's good midwives out here, but the system itself is not built for physiological birth. It's just not. They want beds filled and they want beds emptied, and that means a lot of inductions and a lot of C-sections that aren't necessary. I still feel that the only reason I didn't end up with a C-section after pushing for 3 hours was because I had a midwife who was close to retirement, and she just didn't care. She was like, I'm not letting these OBs in here to stress her out. But I had 3 obstetricians outside my door while I was giving birth to my son. And I was pushing for 3 hours on my back, because that's another thing they didn't tell me, is that even though the prenatal classes all said, oh yeah, you can get into any position you want, when it came time to actually push, I was leaning over the bed and they said, no, get on the bed. And I'm like, well, I don't really want to be on the bed because I have back labor and my son's got a big head. And I knew which position I needed to be in. But when you're in labor, you're vocalizing labor. You're not really able to advocate for yourself at that moment. Anybody who's had a baby, physiologically, without medication, it's really hard to advocate for yourself when you're trying to focus on the contractions and getting in the right position and listening to your body.
Especially at the end.
So I was lying on my back for 3 hours trying to push this kid out, and everybody's yelling at me to push, and I'm freaking out now because I'm like, they're gonna cut me. And I still feel the only reason I didn't get cut was because I had a midwife who advocated for me. But it could have been so much different. And especially with my second, when I had her, I had a lot of prodromal labor. That's a labor that starts and stops. So I had a labor that was going pretty active for 24 hours, and then it just stopped. I was tired, I was hungry, things had slowed down, and my midwife said, okay, your waters are still intact, the baby's still fine, you're still fine, you probably just need some rest. But I've called into the hospital already and said that the home birth is on its way, so we have to either close this file, or I'm going to have to consult an OB, and they're going to break your water, and they're going to induce you, and you're going to have to transfer. And I said, there's no way that's happening. So I went to bed, and I waited until I was sure, which was when my water broke, that baby was actually coming, because you can get to 6 centimeters and you can close up again, ladies. Did you know that? I didn't know that. I thought 6 centimeters, oh, I'm on my way. But no, you have a 6 centimeter dilation, and then you can close back up again. Your cervix isn't, like, it's a sphincter muscle. It will open and it will close. And I had no idea about that. I mean, I'd been studying birth for 2.5 years, and I didn't know that. But my daughter pretty much taught me that, yeah, your cervix can close right back up again from 6 centimeters. And then it can open again. And my labor went really easy. And she was born in the water at home, and I was so happy. But if I hadn't known I had that choice, it could have gone a whole different way for me. I had to really advocate for myself. And that's one thing that we really want to drive home, is that you can be educated on birth, but you also need to know what your system is like, and you have to be willing to stand up for the kind of birth that you want, and hire the care provider you want.
Yeah, interview them.
Yeah.
With my second, I interviewed 4 midwives before I found one that I was happy with.
And it turned out to be the same one.
Turned out to be the same
We got
one,
the same midwife.
Yeah.
It was pretty awesome.
So we've kind of painted a little bit of a bleak picture of birthing in our community.
Yeah, we have.
It's not all bad.
No.
There are some very good care providers. There's some people doing some really good work.
The Power to Push campaign.
The Power to Push campaign is a great one. Is there anything that you're excited about that's up and coming in the birth community?
Well, doing the stats, I've seen that there's a lot more midwives coming into birth.
Our VBAC rates are going up.
Our VBAC rates are going up, yes.
So that means we're actually talking to women who've had cesareans and being like, hey, look, you don't have to have another one, which is great. Or conversely, women are learning that they don't have to have another one and asking to have a VBAC, which is great.
Women are learning more about midwives in our community. There's a big misconception a while ago that midwives you'd have to pay for. And in some provinces that's still true, but a lot of them are covered by MSP. So just look into it.
We're lucky here that it's covered.
Yeah.
The other thing that I'm really excited about is I saw that the Society
of Obstetricians and Gynecologists.
Yeah, that one.
Yeah,
that one.
SOGC. We talk about it a lot.
Has just recently, in the last few months, decided that they are teaching new OBs who are in university learning breech birth.
That is fantastic. Breech birth. Breech vaginal birth.
Yeah, go Canada, go.
Yay! Yay! We want that so badly because it's not fair for these women to have to be told that they just have to have a cesarean when the truth is that breech birth was done up until, I think, the late 90s.
Well, the Power to Push campaign still does. So,
yes.
Yes. I'm sure there's going to be restrictions on it, certain positions, certain
restrictions. But again, even with those restrictions, you can still challenge them because, people will say that you don't have a choice, but you still have a choice. You're just going to have a little bit more pushback from it. But if you do your education, we do have websites that you could check out. It's called the Coalition for Breech Birth. They have excellent stuff. I share stuff like that all the time on their page. On our page, it's amazing, guys. If you're interested in breech birth, join the Coalition for Breech Birth. They have care providers from all around the world. I think they have a few in the States.
Yeah.
But they also have some over in the UK where it's a little bit more common to do breech birth.
Well, they've been doing midwifery has been in their socialized medicine for decades longer than we've had it.
Yes, midwifery care is integrated in there.
Yeah, it's been integrated for a long time. When you go to a hospital in birth in the UK, you're with a midwife unless there's some sort of issue that they can't address.
The Duchess had a midwife, didn't she? I think she had 3 of them.
Yeah.
Guys,
princesses are using
midwives.
Wait, she's not a princess, sorry.
Well, she's
Duchess.
Yeah, her daughter's a princess.
Yeah, royalty.
Princess Charlotte and Prince Louis and Prince George, they were all with midwives.
Yeah. So you're if they're using midwives, you can too.
Midwives are the guardians of physiological birth. They're the ones that see birth in all its variations, whereas the obstetricians, they're more for the specialized areas. They're not bad. It's just that they're trained in a different area. So it depends on the kind of birth you want and the kind of birth you need.
There are situations where we need OBs.
Yes.
And thankfully we have them.
Yes, exactly. Like if you've got complications, you're probably going to need an OB. But if you're one of the 80%, 90%, I think it's like 80 or 90% of vaginal births or something that's just low risk.
Well, that's another thing to mention is that just because you have gestational diabetes or they're complications, but they're not necessarily high risk complications. They don't necessarily risk you out of having midwifery care. So if you have gestational diabetes, you can still be seen by a midwife.
You could be borderline.
Yeah.
You just need to know your numbers. If you're higher up in the risk and the placenta's failing, then that's when you want to have the interventions to get you and the baby to have a safe delivery. But other than that, I mean, just know your numbers, know your health. Yeah. It's very important that you know your own health, not just take everybody's word for it. Because I did not know when I was pregnant with my first. I carry small. So my son, when he dropped into my pelvis, he dropped at 35 weeks. I still didn't have him until 41 weeks, but he dropped early. And one of the midwives in the practice was concerned about that. She thought he had something called intrauterine growth restriction, IUGR. And we went for ultrasounds and we went for non-stress tests right up until my due date. But nothing was showing that there was any real problems. They just said, well, he's small for his size. He's small for his size. I wasn't told that ultrasounds can be off by 5 pounds in either direction. I wasn't told that late-term ultrasounds can be very inaccurate. And I wasn't told that if there was some growth, that he could still go to 41 weeks and be fine. This kid came out 7 pounds, 13 ounces. He was not tiny. Hers was tinier than mine. And she had him at 42 weeks. So if I had known back then what I know now, I probably would have questioned things more. And that's where I really want to drive that point home, is that if you had a birth that you're not happy about because you found out information that you didn't have in the beginning, it's not your fault. You didn't know. But you know now. So you should probably just let other people know because they don't know. And spread the word. I mean, don't get angry at yourself. Don't get angry at other people. Get angry at the system itself. The system is not set up. They don't have the time to sit and explain everything. That's why we're here. That's why the resources are out there. And if you don't have time to Google it, just ask us. Post on our page. Say, hey, I need some information about this. If we have it out there in our files, we'll say, hey, it's already in our files. If we don't have it, we'll go look for it.
Well, we will try and find it.
We'll try to find it for you.
We dig into the deepest depths.
We connect with doulas. We connect with midwives too. I mean, we have midwives that message us sometimes asking, well, what's the stats for this? What's the stats for that? Because they don't have time to look it up. Because they're busy.
They're busy baby catching.
They're catching babies. They're supporting moms. They don't have time to look up the stuff. So we do it for them. And we give them the stuff. And that's what it comes down to, is just advocate for yourself and educate yourself and follow our page. Just come, if you really want to help, come join us.
Yeah, we could definitely use more help.
We could use some help.
We're all moms. We're really busy.
I've got 2. She's got 2. Wendy's got 4. I mean,
Wendy's a superhero.
She's a super mom. I mean, it's just 3 of us out here, and we're kind of needing some help. So if you guys want to come join us, just message us after, or leave a message in the comments saying I want to join you, and we'll meet up after. You can even message us a few days later if you need time to think about it. But it's free to join us. I mean, we just need some.
Don't tell them it's free.
Well, it is.
We should charge them money.
Charge them money. Well, I can't do
We won't charge you money.
We won't charge you money.
We won't charge you money.
She's joking.
Help us start the conversation with other moms.
Just help us start the conversation. I mean, if you know a mom who's wanting to have a vaginal birth after 2 cesareans and her doctor's saying, well, no, you can't because you've had 2 cesareans. We've got a mom who had 3. and she had a VBAC. So the fact is that, yes, she can. If she wants it, she can go for it. If you have a mom who wants to have vaginal breech birth and she really doesn't want a cesarean, well, we can try to find out if there's anybody out there in the Power to Push campaign to help her. I mean, you might have to travel a little bit, but still, it's possible. It's not an unreachable goal. We have a mom who had vaginal birth with twins, and she told us that we could have moms contact her. And of course, with the inductions, we do a big thing around December every year now. Just 25 days to question your induction. So follow that for us. What are the stats for cesareans for moms who have doulas? I don't actually have that.
We know in general that the C-section rates are lower. We don't have
perinatal
numbers
statistics
on
doesn't
that.
do anything on doulas.
That sort of thing.
They really don't.
Yeah.
If they had that stat, I would love it.
They've done studies, and they do have significantly lower rates.
Yes.
But it's not something that they actually track and put up on perinatal
It might
statistics.
be interesting if the doulas would individually track how many of their moms end up having cesareans versus how many don't, and just
some doulas may do that.
You might we
ask
have to
your
get the
doula.
whole community involved really for that. That might be something that we might want to work towards. I am really interested in trying to get UBC or some other universities involved. Anybody who's into birth or studying birth.
Who might have some more information on that is the DONA website. But that would be just, again, in general terms. It wouldn't be specific to our
Oh, you
area.
track yours. Okay.
Oh,
so
hey, good
so
for
what's
you,
your
Kara.
rates? What's your rates, Kara? Do you have them? Or could you share them later? Because we'd be interested. We'd love to.
I'm sure there's something to be proud of.
I'm sure they are. I'm sure they are. And
Yeah.
we keep trying to promote doulas in the community as well. It's wonderful to have a doula and a midwife, because then you've got the guardians of birth on both sides. One to help you and one to make sure the pregnancy and the labor goes smoothly. I loved my doula. She was amazing. Lucinda, I love you if you're watching this. I love you. If you watch this later, I love you. You're just amazing for what you did for me. And you had a doula too,
I've had two
didn't you?
doulas. Yeah. So
When you had a doula?
Yeah, I had one
Maybe.
doula. I had one doula with my first birth.
Yeah.
And then I had a different doula with my second birth, and she was amazing. And it turned out that I was handling things just fine. And then when things got a little crazy,
Turn it for her.
when things got a little crazy, she was just like, "Oh hey, a cell phone," and took pictures. So now I have pictures of my birth that I never asked for, never thought I wanted, and I love them. I cherish them.
You're so lucky you got
I know.
pictures. You're
It's
so
fantastic.
lucky. I got pictures of my daughter after the cord had been cut and everything, and it had been 15, 20 minutes after the birth. Because she came so fast. I mean, nobody got there in time until I got my midwife to catch her, and then the second midwife arrived. And I mean, I wish I had the pictures, but there's still so many good things I could say about my birth.
Kara says she could probably put some stats, but the rates are very low. So okay, so you don't know them off the top of your head, which
That's
why
that's
would
fair.
you?
Yeah.
But
You'd have to be staring at numbers every day to memorize some of this stuff.
Yeah.
Yeah.
I know a few years ago the Power to Push campaign offered a free doula to their patients.
Oh, really?
Because they were studying if having a doula changed outcomes.
I wonder if
So
they're
that
still
might be
doing
neat
that.
to see if they have the information available.
Yeah,
That
we should
would be
look into
interesting.
that.
We should
and,
look into that.
I know that there are doulas who work on a sliding scale. If if you're lower income.
Yeah.
I know ones that. I mean, when you're getting your training to be a doula, and Kara, you might be able to chime in on this a little bit better than I can. But I know when my sisters were training, and this is in Alberta, so I'm not sure if it's any different. But I think
There's doulas in Alberta, ladies.
Yeah, I think it's all through DONA, but they have to attend something like 7 or 8 births before they can be certified, and so they're often offering those for free because they're still in training. So it's certainly, if you are a person who wants a doula, you want that support in your birth. there are a lot of options out there.
Absolutely.
You don't have to be paying a fortune to get the kind of birth and support that you want. The options are out there. We have a lot of connections with doulas and things like that. So you can always contact us if you're looking for. Oh, maybe it's only 2. Hey. So if you want a doula and it's something that you can't really afford, we can always go to our contacts and see what we can find for you. But doulas are the reason people are doulas is because they are passionate about it. They want every woman who wants a doula to have a doula. So
birth can be transformative.
Yeah,
it really can.
So there are ways around barriers. There are. Yeah.
Yeah, definitely.
Yeah. I think that's probably it for our rally.
Yeah,
Unless anybody has any questions.
Any questions? Or I know there's
Kara there.
rally to cover doula costs through MSP.
That would be interesting. I've heard a couple different opinions on this. Some people are very, very for it. And then some people bring up the opposite side of the coin as soon as you start funding things, they start making rules for you. Yeah. Right?
And we really don't want
what kind of rules are we looking at putting on doulas, right? I
don't want any rules on doulas.
Yeah, I mean there's already the they can't do anything medical, obviously. Yeah. They're not trained medical professionals. And they sort of can sometimes flirt with that line a little bit, I guess. I mean, some doctors will find.
How many would be able to advocate for moms against certain procedures that are integrated into the hospital system?
Once there's started being paid for by MSP, it kind of opens the door to regulation. And sometimes that can be not so good. It would be interesting to see the perspective of what kind of regulations they would be thinking of putting on, because I don't think if we went to paying for doulas through the government, I don't think they would do that without imposing some sort of regulations, and it would be interesting to see what kind of regulations they would be doing, what they would be thinking
I'd be
about.
hesitant at this point with the way our culture is. I mean, maybe if our birth culture completely changed and they were more for physiological birth, but we already have rules because of licensing, insurance. I can't see the rest here. Let's see. Because it doesn't affect the care provided because it's not a medical position. Okay, well, we would probably need to discuss it more, find out what was going on.
Yeah, well, because I'm wondering they would probably do, consultations with doctors and things, people who work with doulas. I wonder, doctors have a lot of power.
They do.
I'm wondering what kind of rules they would set for doulas as far as, how much advocating for their patient could they do? Yeah. Right?
I think what
would you just have to be silent in there and only ever talk to your client? If you even mentioned an alternative, would they shut you down? It would be interesting to look into that further.
Maybe if we changed the birth culture first, then it might be something that would be, or having the government realize that it's more economical to have physiological birth than to have all these inductions and all these C-sections. I mean, if they really saw the numbers.
Well, we did. Yeah, we looked. I can't remember if we even have the actual numbers in front of us, but I know that a C-section birth it's really expensive.
It is. It's really expensive.
Inductions
are expensive. Pitocine's expensive.
It's $15,000 or something for a C-section, and I
think that's what it is.
It's $8,000 for an uncomplicated.
And that's uncomplicated vaginal birth. That's not even necessarily without meds or any inductions or anything. Yeah, I'd like to see what it is at a home birth.
Yeah, it would be interesting to see how much a home birth costs. Yeah.
Because if we could get the birth culture itself to change so that we realize that physiological birth for uncomplicated pregnancies is going to be more economical, and it's going to be healthier for moms and healthier for babies.
Yeah,
It would lower our medical bills.
we know that midwifery is, like, you look at countries like Sweden and the Netherlands. They're very big on midwifery care and home birth, and they don't pay nearly as much for healthcare as we do.
And maybe if we lowered the cesarean rates and the induction rates and all the medicalized birth for
there's
women.
medical costs on top of having these things. Like, it's not just, oh, your C-section costs that much.
Yeah,
it's there's complications afterwards.
Yeah,
like I have chronic pain from mine,
which freaking sucks. You only had the one C-section.
I just had the one, and I have chronic pain. So now I see a doctor and a chronic pain specialist, and I'm costing all this money because somebody gave me a C-section that I may or may not have needed.
And you had a pretty straightforward C-section too, didn't you?
Yeah.
Yeah.
Yeah, I didn't have an infection. I was pretty much healed up within a couple weeks. Like, it was very textbook.
And yet she still has the pain.
Yeah.
Which costs our health care.
Yeah.
I mean, if we lowered our health care costs for C-sections and inductions, maybe we would be able to fund doulas.
Well, and not only, like, how many people are told when they're, going to have a C-section that now they're risking something like a CRETA or percreta.
Or is it just the uterine rupture rate, the scary uterine rupture rate?
Yeah,
is what I hear
we're
a
all
lot.
really scared of the uterine rupture rate, which is about the same as having a cord prolapse or any other thing that doesn't risk you out of a vaginal birth. That's what you're told about, but you're not told that, oh, I want to have, potentially I want to have 5 kids. My first one was a C-section. Now I'm risking hemorrhaging and bleeding out.
Hysterectomy.
And a full hysterectomy with every C-section I have.
We have an infographic
major every time.
We post I think it's from VBAC Facts, is it?
Yeah, I love VBAC Facts.
And ICAN, the International Cesarean Awareness Network.
Yeah.
Both great sites for information on VBAC.
VBAC Facts is really awesome. She's Jen Camel. She's actually a nurse.
I think she's followed us a few times too. She's posted a few things.
Yeah, she's a nurse, and she runs VBACFacts.com, and so she breaks down all this medical jargon, and she breaks it all down into stuff you can understand.
Breaks down the studies too.
Yeah, what exactly do these stats mean? Because stats can be
very, very tricky.
Yeah.
Believe me, they can be very tricky. I sit there and I look through them and I'm like, okay, now I have to go through this and this and this. It's an all-day thing sometimes for that one induction report I did. That took forever to break all that stuff down, and I was just lucky I had the numbers because I'm doing the work for perinatal services.
Yeah, and if you have a high tolerance level for pain, you can go to the perinatal statistics website all by yourself and go look up these things if you like. It's not the greatest website in the world.
It's a great website for information. It's not so great to find all that information in one place, and that's basically what I've been doing for the past year, is taking the stats from Fraser Health and Vancouver Coastal Health and Island Health and Interior Health and Northern Health, and also Provincial Health, which is just BC Women's Hospital, and BC Stats. And I'm trying to combine them all so that you can see all the numbers and see where Fraser Health rates as far as the rest of BC. And it's just involved on how much I've got to do here, guys. Yeah, I mean, I'm sorry it's not up yet.
We're gluttons for punishment is what it is. Yeah.
I'd say I'm a pretty bad glutton for punishment with these stats.
Yeah, we were winding down before, and then we got all excited and passionate again.
Yeah. That tends to be what happens.
So we should go back to winding down.
Okay. Yeah.
So, unless there's any more questions or any more comments, we were talking about doulas paid for by MSP, which I think is definitely it would be an interesting conversation to have.
That would definitely be interesting.
Sure.
I mean, I'd be for it if we can change the birth culture around it.
Yeah.
I just don't want you guys to end up in a position that is going to not work, because the burnout rate is already so bad, and I don't want to put any more pressure on you guys. I want you guys to be able to support us. I don't want the system to take over
hands
that.
tied by the system
I don't
is
want
a
the
problem,
system to
yeah.
take over that.
Yeah.
That's what it comes down to. Is the system is broken, and we need to fix that. And a lot of great doctors within the system, and a lot of great midwives within the system, and even maternity care nurses. I mean, you guys are awesome, but we know what it's like. We know that there's things in the bureaucracy, and the hands are tied, and you don't want to tell the patient that they have to do this, but if you don't, you're going to get written up or something for it. We know what it's like. We understand. We're advocating for the moms so that they come in with more knowledge, so you can do your job, and that you can just say, well, the patient refused. But if you're the one saying, well, you can refuse this, we know you're probably going to get in trouble. That's why we're telling them for you. I mean, we want you guys to be able to support moms. We know you didn't get into this work to bully them. We know that. We love you guys. We do.
We do. We love doulas.
We love
We
doulas.
do.
We
They're
love
the best.
midwives. We love maternity care nurses. We love OBs. I mean, without you guys, what are we gonna do? I mean, we need
You guys
we
are
need the
catching.
support.
You guys are catching babies. And
Yeah, you're
working them
amazing.
out.
And you're helping out
yeah.
moms that need the help.
Yeah.
And I mean,
It's fantastic.
It's-
you guys have.
it's wonderful.
You guys have amazing jobs.
it's something I probably couldn't do. That's why I do birth advocacy instead. I've got 2 kids that I don't have. My plate's full, plus the stats.
Yeah.
And she's got her stuff too. I mean,
Yeah, we're busy.
we're busy,
Yeah.
but I
And
mean,
you guys
we'd
are
love
busy
help.
too.
We'd
Yeah.
love help.
Yeah.
And if you guys can spread the word in the community and keep letting us know when there's events coming up. I mean, we'd love to get some funding at some point, but we need to try and figure out how to do fundraisers. So if there's anybody out there who knows how to do fundraising and could help us, we would love that,
Yes,
because then we can get some
would
funding.
Definitely love that. Yeah.
We did the baby fair back when, like, 2.5 years ago, and
Yeah,
that was
that was-
amazing.
Yeah,
We
that was
loved that.
amazing. We had a VBAC sign up there, and just the sheer number of moms who came up to us being like, "You can do that," and we're like,
Mhm.
"Oh, this is a problem."
Yes.
This is a very big problem if we have so many people coming to us being like, "I didn't know you could do that." Of course you can.
Yeah,
Of
and
course
it's so
you can.
common how many people think that they just have to have another C-section,
Yeah.
and they just don't know. Or they say, oh, well, I was told that the uterine rupture rate is too high, and then when they hear the actual number, they're like, wait, that's it?
Yeah.
Or even the inductions, it's like, well, the risk of stillbirth goes up. It's only 1 per 1,000.
Yeah.
1
Yeah.
per 1,000 at 41 weeks, and 2 per 1,000 at 42
Which
weeks.
for someone might be too high, but
For
for
some.
others it might be too low. It's not a risk
I know
that they're
that
really
when,
concerned about.
I know
so.
when my midwife told me that when I was pregnant with my daughter, I'm like, it's only that much?
Well, you can look at the difference between like how people say things too. Like, so when I was
Yeah.
at 42 weeks, the OB came and is like, "Oh, your chance of stillbirth at this point goes up 300% or
Yeah.
200%
It's
or
the
whatever."
way
And I'm
they
like,
say it.
"Oh my god, are you kidding me?"
Yeah,
And then my midwife was like,
but it's
"Yeah,
the-
it's
you gotta
200%.
get the
It's
numbers.
200% of a tenth of a percent." So
Yeah.
now now it's instead of 1 in 1,000 or half of 1,000 in 1,000, it's 1 in 1,000, right?
I mean, for perspective on this, I mean, I've got one of the perinatal health things right now for, I think I'm doing Island Health, and they had 13 births, and then they went down to 2 births at this hospital in Port McNeill, and it was like something like the increase or decrease was like 86%. I mean, it's from 13 to 2, so of course it's going to be an 86%, but I mean, those numbers aren't even, it's 13
Yeah,
births.
That is the
of course
thing
it's
about,
going to come
that is
down.
the thing about statistics is you have to
have the
you have to
actual
look at,
numbers.
You have to be looking at the raw data to understand what
Yeah.
it's actually saying. Yeah.
And that's what we're doing with the perinatal services,
Yeah.
which is why it's taking so long and why they don't want to do it and why I'm the one who's doing it.
Yeah.
I mean, once I get the data, it's easy, but I mean, it's just a lot of writing, guys.
Yeah, it'll definitely, anybody who's interested in birth will be should at least find our files an interesting read.
We have handouts too that are a lot less stats, and they have information on questions to ask before you get induced.
Yeah, so definitely
questions
look
to
at
ask
those.
before C-section.
Yeah, you can even provide them to your clients and things like that if you want.
Thank you, Kara. We will continue to keep doing it. I mean, we didn't get much turnout last year, but I mean, we're trying to do something different. We figure the video will help because a lot of moms, we know you're busy. We know that the midwives have babies to catch. We know doulas are there supporting moms. You guys can't all show up.
Our video here is already longer than most moms, so we're going to be able to sit here in quietness. So we should probably get off our soapboxes now.
Yes, we're going to get off our soapbox now, but we love you guys. Thank you.
Thank you for joining us. It's awesome to see you commenting with us and interacting with us. That's great. That's awesome. I think we should do this again.
Yes, I love this.
Yeah,
this
we should do it more than just for the rally.
Yes.
And it's also not cold and raining on me right now.
Yes,
which
I
I'm
know.
super stoked about.
I love that.
Yeah. And it's not raining on the people who are coming to visit us.
I know.
So that's nice too.
And they don't have to leave their house.
They can be sitting in their living room having coffee.
I know. Yeah. It's awesome. It's perfect, and they can come back after and watch it if they missed it.
You can pause it when your child screams, and then you can start it again.
I know. Isn't that great?
This is a good
This
format.
is good.
I
like this.
Yeah, I'm a fan of this.
We're gonna do this again. All right. So
okay. Well, thank you everybody for joining us. Yeah, and
thank you for anybody who tunes in later. And if you have any comments, just leave them in the comments for us. Send us a message. We love interacting with our followers.
We
absolutely
sure do.
Love it.
Yeah.
So we want to do it more.
Thank you again.
Thank you.
And bye.
Bye.